So we know that children develop with a lot of different influences, and their school and the community surrounding it is a big part of the support system that our youth have as they develop. So through this project, instead of targeting just direct education to youth, we're also providing a safe environment for them that's free of stigma and has adults who understand what they may be experiencing if they are in a home with addiction.
Project Train started in 2018 with a survey of West Virginia K-12 public school teachers. And so what we decided was to survey the teachers and find out how the opioid crisis was impacting them in their classrooms. And what we learned was that, as we thought, teachers did not feel as prepared as they thought they perhaps could be, and really hadn't had any training on the topic and how to work with kids from addictive homes.
I'm really honored to be a part of this project, specifically because coming from a small community where everyone's so close, it's really important that we make a positive impact related to stigma. And research is showing that in communities where there's stigmatizing language still used and this misconception about substance use disorder, that it's critically important that we find ways to put a positive spin on that, so that not only do our neighbors and our friends get the help that they need and enter into recovery, but so that our communities can become stronger.
The Rural Health and Safety Education Grant, which is called the RHSE grant, is a partnership of WVU Extension and the College of Applied Human Sciences, and we're working in 4 rural communities in West Virginia. So in each of those counties, we're working with one school site, and we are looking to provide direct education to both the youth enrolled in that school site and the adults and community members surrounding that school. And the goal of the project is to really immerse that school community in education and support to reduce stigma related to substance use disorder in high-risk communities in West Virginia.
We developed some training modules, 3 training modules for K-12 teachers to learn about the science of addiction, to learn about stigma, and to learn skills and resources for working with children from addictive homes. We have had over 500 West Virginia teachers trained so far, and we've also learned from our extension faculty that teenagers could benefit in general from learning about addiction. So we now have a teen track, which we've recently adapted for middle schoolers as part of the RHSE grant, so we can share that with 6th graders.
And we're working to provide the Botman Life Skills Training Program to 6th grade students at partnering school sites. In addition to that, we're providing the TRAIN program, which stands for Training for Addiction Impact Now, to teachers, after-school personnel, community members, and others in that school community.
So our hope is by providing some concentrated intervention that we can really help bend the arc of addiction and bend the arc of negative outcomes for children who are experiencing addiction in their homes.
And we know that our kids are our future. So by us providing through this grant project, by us giving them the skills that they really need to become resilient adults, we are investing in West Virginia's future.